Good afternoon, Professor Ash and panel. My name is Michelle Williams, and I'm going to present to you Beyond the School Gate, Connecting the Dots Around the Child, as part of my Master of Professional Psychology application specialising in school psychology. Now, before I continue, you must know that this material contains confronting and disturbing information. Know that Lifeline's there.
12-year-old Lauren knew she was in trouble.
I didn't know how much she was hiding it.
But when she asked her school counselor for help, nothing happened.
Anything would have been better than nothing.
Not even a phone call to her mother.
I don't have a psychology degree. That sets off alarm bells for me.
And that set off alarm bells for me. This case study, unfortunately, I've learnt, is a familiar one among parents in Australia. It really sparked my curiosity. When a school psychologist recognises that a child needs more help, who do they tell? And what happens when the experts sit beyond the school gate? I'm going to take you through the rationale, methodology, feasibility, and significance. And last of all, why me to conduct this study? Research findings show that school psychologists collaborated more fully within their school environment and less so with external agencies. More importantly, Teal King and colleagues have shown that there are external barriers that school psychologists face, including time, blurred confidentiality, and access to external health providers. There are also some internal factors at play here. Preparedness was associated with interprofessional collaboration, meaning if the school psychologist felt prepared in knowing how to collaborate with other professions, then they were more inclined to do so. This led me to my question of experience and confidence. Findings in studies are that more experience in consultation is linked with greater confidence. So answering a research gap, does consultation self-efficacy predict interprofessional collaboration with external health professionals among Australian school psychologists? My methodology begins with my aims. Does greater consultation confidence relate to stronger collaboration with health professionals? And does experience of the school psychologist change this relationship? My participants are Australian school psychologists, registered, provisionally registered, and currently working in Australian schools. My self-report measures, valid self-report measures, are measuring consultation self-efficacy, meaning how confident does the psychologist feel, and interprofessional collaboration using the Human Services Integration measure, which really looks at the depth of collaboration within school psychologists. I will use a quantitative cross-sectional on design that, as I mentioned, has the online surveys. In my analysis, I'm really looking for one, yes, confidence, higher confidence leads to more collaboration, and also whether the experience of the psychologist changes this relationship. Why is this study important and how feasible is it? The online surveys really make this study accessible to school psychologists anywhere They can do it wherever they have access to a computer. And I will look at 110 school psychologists as part of my sample size, making this manageable within a 12-month timeframe, using minimal costs that will be shared amongst my research team. Why does this study matter? Well, at the moment, what I'm seeing in schools is that parents are having to repeat their story, school with the school psychologist, maybe their GP, and other health professionals, and that these health professionals are not all collaborating together. So if we know that confidence has a part to play, then universities could look at this to improve their training and start to really build school psychologists working in multidisciplinary teams within other faculties in the universities. And this can also link to connecting school psychologists with outside services in the community before they're stepping into schools, meaning that education and health are working together to better support young people. Why me? Well, I've had 25 years working in schools. I really understand the demands of the school environment and what happens when a student, a child, needs help. Getting that help for them is not always easy. My study at Monash has really prepared me to have an understanding of the ethical implications, being culturally responsive, and really honing in on that scientific practitioner model. For me, fitness for practice means knowing my limits and seeking supervision, working ethically and reflecting on my practice. I'm a team player, school psychologist, health professional, because bridging the gap in mental health support for young people together is what really counts. And I really look forward to working as part of your team. Thank you.